Welcome back, guys, to another episode of the Defying All Odds Podcast with your host, Jesse, and my co-host,
Rafa, you already know.
And today we have a very special episode coming to you live here at New York Presbyterian Hospital, Weill Cornell Medical Center. We have the Chairman of Neurosurgery and Neurosurgeon in Chief. Please welcome Dr. Philip Stieg.
Thank you.
Thank you so much for being here, Dr. Stieg.
It's a pleasure.
Well, obviously, we're at Weill Cornell. We're at this prestigious institution and this vast hospital. Why don't you tell a little bit about the viewers, a little bit about what's your role as chairman, what duties you have to kind of partake on a day-to-day basis, and what that's like for you.
Right. So, being an academic institution, I'm the chairman of the Department of Neurological Surgery, but the neurosurgeon in chief at New York Presbyterian Hospital. So it's a twofold job. I'm responsible for the department's operations at the hospital and also for the department's academic mission at Weill Cornell Medicine. So in those regards, on the hospital level, I have to make sure that we appropriately meet our milestones regarding volume, quality patient care, patient satisfaction, working with all the other staff members, the nursing staff, anesthesia staff, other physicians, neurology, the ICU, trying to make sure that all of those systems are in place and run smoothly and adequately. On the academic side, I'm also responsible then for overseeing the teaching, research, and education component. So I work with medical students like you. We also have fellows. We have resident staff. We have 14 residents on our staff that we're involved with teaching. In addition to that, we have lab space and we have federally funded grants and foundational supported research activities so that we can advance the field of neurological surgery. In addition to that, we have social media activities so that people are aware of who we are, just like you're doing this. Yes. We appreciate this.
Yes.
It makes it fun. So it's a very diverse job. And then there's the hardest part of the whole job is the human resource component, managing the 250 employees that we have in the Department of Neurological Surgery. In addition to that, we've expanded because now New York Presbyterian has networks, and within the Weill Cornell sphere, we're also managing the New York Presbyterian Queens and New York Presbyterian Brooklyn Methodist hospitals. And so we have our team of neurosurgeons and neurologists out there. So that's part of my job, is to make sure that that system is all integrated.
I see.
Well, would you say that obviously managing so many different roles at once and managing across different locations, what is that, on a day-to-day basis, how's that strenuous in regards to your work while balancing obviously your patient life when you're taking care of your patients or when you're in the OR?
Obviously, I can't do all of that by myself.
Right.
Right. So I have a very strong team of senior faculty members, administrators, members out at Brooklyn, members at Queens that help me do all of these things. My job is to administrate and delegate. In a position like this, you can't be a control freak. You have to be able to delegate and just trust the people that you have working around you. Sometimes there's mistakes that get made, and we have to correct for that.
Yes.
So that still, by having a really good team around me, it allows me to still take care of my patients, provide the high quality care that I want to provide, but also to mentor junior faculty, residents, nurse practitioners, PAs in the hospital, so that they can also be more effective in our overall mission, which number one is patient care, and then there's the research and education components.
Okay. In general, what would you say is the most enjoyable part of all these multiple hands that you have going in? What interests you the most in there?
Well, I've been doing this for a few years, and I have to say that the thing that still is most gratifying to me is the interaction with patients, sharing with them whatever their healthcare issue is from a neurosurgical perspective, and trying to help them find an answer to that healthcare problem, whether it be surgery or not surgery, observation. We also as you know, in neurosurgery, it's not only that we do open surgery of the brain and open surgery of the spine, but we also do what's called endovascular therapy, where we put little tubes in blood vessels and treat blood vessel disease. We also do things called stereotactic radiosurgery, which is radiation. We do something called focus ultrasound, which is focus ultrasound delivered to the brain.
Wow.
We're involved with the neuro-oncologists in terms of chemotherapy. So there's many perspectives of the disease process that we work with the patient to try to help them understand so that they can make, in my mind, the best decision they can make about their healthcare issue.
That's great.
I think obviously coming here, obviously you kind of interact with so many different patients of different backgrounds, whether that's people from overseas as well, they'll come here and see you. What has that kind of experience been like for you, and like what challenges kind of exist when you're interacting with patients, from so many different backgrounds and they come here to see you?
Well, it's something that gets talked about very commonly now under the DEI rubric. It's something that we here in the Department of Neurological Surgery have valued highly since I got here 25 years ago, which is, you try to understand where the person is coming from, whether they come from the Middle East or they come from Europe or South America, because that does have an effect on trying to understand how they relate to their disease process. Whether you're wealthy or not wealthy doesn't affect the way I think about it. It means that the individual thinks about it a little bit differently.
Mhm.
And so I have to spend that time trying to understand them. So when I meet a new patient, the first 15 minutes is spent trying to understand who they are, where they came from, are they married with children, responsibilities, and how is their disease process affected their life? So it's really important to understand where they come from, but more importantly in my mind is that it's important to understand humankind
I agree.
That's true.
and trying to relate to them from their perspective, which means I have to be a little bit of a chameleon,
Yeah.
right?
It's,
But I find that enjoyable, trying to understand people.
sometimes it feels like maybe like you have to be in some ways like a therapist at times.
Listen, I don't think that that's a skill set that most people would attribute to a neurological surgeon, but it's a skill set that I value very highly.
Mhm.
As a matter of fact, when we're interviewing resident applicants for our program, we break it up into 6 different sections.
Okay.
And one of those sections focuses completely on emotional IQ.
I see.
I think that it's extremely important for a neurosurgeon to be sensitive about not only their skill set and their abilities, but really trying to understand what the patient wants. That's the important thing. We can always operate, but is that the right thing to do? And that involves, in my mind, emotional IQ, integrity, compassion, those characteristics that are extremely important.
Okay.
In regards to like those values, I think you bring an excellent point. Obviously, not just being there for your patient, but also being able to empathize and understand your patient on an emotional level. Obviously, you have a PhD as well, along with your MD title. What would you say is like the skill set that kind of transfers over from obviously your research side into your academic side, as well as what kind of led you down that path of the PhD MD route versus just going an MD?
Yeah. Well, when I was your age, I was confused. And I had benevolent parents who allowed me to sort of explore my life. And I initially started with getting a PhD. And I'm really happy I did that, because the thinking process and the mechanics of being a PhD are very different than the mechanics of being a clinician. I think to be a good physician, one has to know how to listen.
Okay.
And when you're a PhD, you also have to listen, and you have to think, you have to ruminate and cultivate the ideas, because it's a different type of creative process. It's the art form of science, all right? Versus medicine, it's the art form of medicine. It's understanding, putting together things, but there's a very large data bank so that you can make the diagnosis for the appropriate patient. So they're both very different, but I'm really glad that I did both. It taught me different thinking processes. And certainly in the academic arena, it's important since I have PhDs are employed within the department. I feel as though I'm sympathetic, empathetic,
Yeah.
and I know how to relate to them
Right.
versus an MD. Now, if I was an MD that had gone down to the NIH and spent a couple of years, I would have gained those. That's another pathway that somebody can follow to get to the same endpoint.
I see. So someone like me, I'm not very versed in the world of medicine as much as, let's say, just right. I know he has a lot of experience in this field, but someone like me, or for others who don't know too much, and maybe potentially are thinking about going onto a similar path like yourself, what would you say to those people on how to maneuver themselves through it all?
You mean how to get into medicine, the pathway?
Yeah, and more specifically, just kind of what ideas and tips you can give someone that wants to pursue this more, long term.
Well, let me say this. I think that medicine is a very diverse field. And not everybody's cut out to be a neurosurgeon. There are different aspects of medicine. There's radiology, there's pathology, there's internal medicine, there's cardiology, and I can go on and on about all the various subspecialties. And I will say that each one of those categories have different personality sorts. Pediatricians are very different than cardiac surgeons.
Right.
So, you have to kind of sort that out, what kind of a person you are, which you can do when you're my chief resident right now was a high school student with me.
Okay.
And she kind of worked her way up, went to undergrad, went to medical school, and then she came here for her residency. So it's been, for me, I almost feel like her second father. Okay. So it's been watching her grow up in this field. But getting involved in it, I think, number one, you have to go taste it and go do a rotation with a doctor, like Jesse spent some time with me. You get a sense of, and maybe I had one student that spent a lot of time with me and didn't go into neurosurgery, he went into ophthalmology. That's fine. He figured out who he was. And as I said, each subspecialty has a very different personality. In terms of the mechanics of it, you have to obviously do well in college, and there are medical school prerequisites. And I would also state that you don't only have to be a physician. Okay.
Why you say that?
Well, you can be a physician's assistant, you can be a nurse, you can be a nurse practitioner. I mean, there are other aspects. You can be a technician in various departments. So, there are many avenues to be involved beyond just the mechanics of being a doctor or the mechanics of being a scientist. All right. And if you're a more contemplative sort, meaning that you like to think and ruminate, science is great for you. Okay. I will emphasize, however, that over the years, everything has become a little bit more businesslike. You read about the scientists that are starting their own companies, right?
Right.
And physicians are starting their large practice groups. They're forming hospitals. Hospitals are becoming larger organizations. So that's the other aspect that you have to be prepared for, is managing the business side of all this.
Yeah, no. I mean, at the end of the day, everything, for better or for worse, is a business.
Yeah.
Right.
Yeah.
I work with my father in his own business, so I'm very into all of that. Now, going a little more into what you said about a lot of scientists making their own companies and such, would you say that's a good thing or a bad thing, or something in the middle?
I would say it's a good thing as long as you avoid conflict of interest.
Okay.
Okay? Meaning, if you have a company, you can't run the study because then you have a potential conflict and that sort of thing. But I do think that, America is built on capitalism, and that entrepreneurial spirit is provoked by, wanting to create, wanting to treat. And as long as you follow the scientific method and you don't have any conflicts, I think that it's what drives America. It's the ingenuity of America.
It pushes us more to evolve and grow in another direction and find new methods and treatments and such.
I also think that, it makes sense that obviously, as we see, there's also been a shift between the MD PhD route. Now you see a lot more physicians are taking the MD MBA route. in regards to obviously starting their own businesses or getting into leadership positions. Now, in regards to your current position as chair, what would you say kind of led you down that route to like, if you wanted to, was it more so that you aspired to just be in a leadership position, or was it more so that you were kind of motivated to basically kind of institutionalize and innovate the Department of Neurological Surgery at Weill Cornell?
To be very honest with you, I grew up in neurosurgery at a time when neurosurgeons were very different. They were more iconoclastic. They weren't known as the most sociable people. They were a little bit, they were single sport people. They were never team sport people.
Okay.
They were very focused. And when I started, the results in neurosurgery weren't what they are now because we didn't have the micro instruments, the image guidance, the electrophysiologic the techniques that we have, the neuroanesthesia, the neuro ICU, have all contributed to make neurosurgery a much more positive event in people's lives than what it was when I first started a long time ago. So it was a combination of the personality that I didn't ascribe to, and recognizing that there's so much potential to alleviate pain and suffering from a neurosurgical perspective, that I was really motivated to try to create a department where everybody actually liked each other and everybody worked together and we had a common mission. And so, yes, I did want to be a chairman of a department because I wanted to prove that you can get a group of neurosurgeons and an entire team that are focused, laser focused on providing high quality care and being compassionate. And so I had 7 core principles upon which I hired everybody.
Can you tell us what they're?
Sure. It was, it's integrity, compassion, compulsivity, surgical excellence, scientific curiosity, leadership, and perseverance.
Man, those are great.
Yeah. So those characteristics are what I hold myself accountable to, and I hold everybody else accountable to. Have we failed sometimes? Of course.
Right.
To err is human. But all in all, we've been incredibly successful.
Okay. No, that's awesome.
I think also, being able to kind of put yourself in that position and take on so much responsibility all at once bears obviously a great deal of stress at times. But like yourself, you're also a very big advocate for brain health and education. What would you say is like some of the misconceptions that especially young people take nowadays in regards to brain health? And what are ways that we could kind of mitigate the effects of kind of those misconceptions?
I don't know as though it's as much misconceptions as it is lack of focus. And by that, I mean, the reality of it is Alzheimer's disease is something that starts to manifest itself maybe in the 50s, but, somewhere between 50 and 70. But it's actually a process that starts in the 30s.
Oh, really?
Okay.
Wow.
So we don't fully understand it, but there are steps that we can take to help prevent Alzheimer's disease. We don't know as though they're 100%. Just like 70% of health problems in America are preventable. You can't change your gene pool, you can't change your gender, you can't change your ethnicity, but you can certainly change your diet, your cholesterol, your blood sugars, your sleep, your exercise, and mindfulness. Okay, so those are things that you and I have control over in our lives. And the fundamental problem that we have in America is watch the Super Bowl, okay, and tell me whether you see one healthy food advertisement.
That's very true.
Right?
That's true.
So, and you walk into the grocery store. Why do they have the milk, eggs, and that at the back? Because before you get there, they have you walk past the potato chips and all that kind of stuff. So I think that, business is business, but we don't do a really good job as individuals of saying, okay, I'm going to have to live a disciplined life if I want to live a healthy life.
Right.
And they want to come to me and say, all right, doc, fix it so I can go back to that same old bad lifestyle.
Right.
So I think that's a problem in America.
I agree. I think it's very true when it comes to people that, I'm not even just people, but like you mentioned, the commercial sense of how we push products into society, gears people to want to lean to those particular food choices
Right.
and products that inevitably put them in a worse position later on.
Well, I used to be the president of the American Heart Association here in New York City, and we had food fairs, and we would try to go to the public schools and say, let's put these healthy lunches out for the children. Parents actually didn't like that. They said,
Really?
yeah, how dare you tell my child what to eat, you
Wow.
know? And so, it's trying to find that balance. I'm not saying the parents are wrong,
Right.
but I am, it's part of an educational process, which is very difficult
Yeah.
in today's age.
Would you also say that, like, I guess the rise of social media and the rise of, like, as we're seeing a kind of a lack of concentration, a lack of focus nowadays, specifically within, like, obviously college student populations, and even here, with medical students in your residence, would you say that that's kind of led down the path of, like, the kind of abuse of lack of sleep, or like abuse of, like, lack of nutrition, people skipping meals and that sort of thing with stress, of course?
Well, I think we can spend hours talking about the impact of social media.
Right.
All right. I've always been interested in the impact of social media in terms of the way it affects your neural networks. How many of you, when's the last time you read a book from cover to cover?
Bueno.
Right. But what do you do now? You scan read. All right. So you develop short-term memory. You develop working memory, but you don't develop a lot of long-term digestible material.
That's right.
It has changed the way our brain is wired and the way it interacts. It changes your attention focus. 20 years ago, the average concentration was 2 minutes and 43 seconds. Now it's about 43 seconds. Okay, so your ability to concentrate has changed as a result of social media.
Mm-hmm.
In addition to that, as you well know, there's so much false information. And even when they try to generate real information with AI, there's still, 60 to 80% hallucination rates. So it becomes very difficult to know what you're reading, whether it's real.
That's true.
So it's really made life exceedingly complex. And from a physician standpoint, I don't really allow patients to start rambling to me about, well, Google told me this,
Right.
or Amazon, whatever, whoever told me that. I say, no, you're here for my opinion.
Exactly.
And I'm going to give you my opinion. Whether you like that or not is okay, but I don't want to waste the precious time that I have with them trying to disavow them of the false information or the misunderstanding that they got by going online.
Yeah, I see your point too. I think in general, using social media definitely creates that separation of what you want, what you can or cannot believe, and at the end of the day, it changes your view on certain topics and certain points, particularly with a lot of medicine. A lot of people in general, there's a lot of people who don't like to believe what hospitals can do for
Right.
one, and believe that it's just all just for money and for the
Yeah.
business side.
Right.
Well, but again, there are reliable sites to go to where people can get information. So, like the American Heart Association, the American Cancer Societies, some of the Alzheimer's sites.
Right.
Certainly, what's the number one healthcare problem in America right now? Obesity.
Right.
That's a fact,
Okay.
yes.
So there's a lot of information out there about the new obesity drugs. Now, that information is out there, but then there's also the problem where not everybody has a Ph.D. and they can't understand the information they're reading. So it really takes time for the physician to sit down and make it understandable to the patient.
Right. And do you
Right.
think, like what you were saying back with like the Super Bowl and how they, promote a lot of bad products, quote unquote, products that are not the healthiest options. Would you say if we as a society or as a country switch that over to putting more, positive, healthier choices, I'd say, would you say that make a better change to that?
Well, the answer to your question, if we could achieve that, yes.
Right.
But you know as well as I do, when you turn the TV on in the morning and the news is on, do they tell you about happy or good things, or do they tell you about car accidents, fires, and
Always negative.
bad news
the latter
sells.
first,
Bad
yes.
news sells. And let's face it, a big juicy cheeseburger with mayonnaise, ketchup, and lettuce and tomato looks a heck of a lot better than a piece of fish.
Sure.
So it's how do we make healthy living attractive to people is hard.
That's true.
So obviously, you and your team, you guys have been have like global efforts, whether that's in Tanzania and various other countries. What would you say that it's been like, kind of being there and witnessing kind of what life is like there in comparison to when you're treating your patients here in America, for instance? What's that difference been like for you and your team?
Yeah. Well, let's face it, the technology that's available to here in the United States, and by technology, I mean just the fact that you've got clean rooms, laminar flow air, meaning the air gets sucked up so that there's fewer infections, versus in Tanzania, I walk in and there's just giant wards with patients laying on a mat that their family provided and the family bringing in food and flies all around. It's a very different environment. And then certainly the technology in the operating room, the technology in the ICU is different. They're underdeveloped. They want to be there. So, but they are eager to
Right.
want to do the right thing. So it's been a very positive interaction going there and, not trying to tell them how to do stuff, but say, okay, and through the years, we've brought newer equipment to them, instructing them how to use it and how to apply it in their patients. So that's been incredibly rewarding. As we've said, we've done a lot of it in Tanzania. We also lecture on an annual basis at the American Austrian Foundation. It's called in Salzburg, where we lecture to neurosurgeons from around the world: Mongolia, South America, the Middle East, Russia. Again, trying to create a dialogue where they can understand how we approach medicine and they can pick the things they like.
Wouldn't you say, I always felt like medicine is something very universal. I feel like in the way that it should be, I guess, taught and also operated. Do you, going to all these other countries and stuff, I assume you definitely learn different techniques and ways of certain, let's say basic procedures here that
Yeah.
we normally do. What would you say in that realm of like trying to give people that language barrier, right? To try to even it out for everyone to understand.
Yeah, I would have to say that the neurosurgical disease is neurosurgical disease. Now they have more fungal disease in Africa than we have here.
Right.
And when patients come into the city, their tumors are sometimes 3 times the size of what we normally have to deal with.
Okay.
So it's more of a magnitude problem than it is a difference. Again, you have to look at the socioeconomic status of a country. And there's a lot more money floating around the United States than there is in some of these places. So there's more latitude to work and teach people. It's a difficult process. And, the only thing that we can do is when we go over to Tanzania, we try to work with the Ministry of Health and possibly change their value system. Now they don't have the wealth of America, but within their system, how much of their gross domestic product should be put into healthcare? In America, it's 18 to 20%.
Okay.
It's not that big in these other countries. Could it be a little bit higher? And by doing that, would they improve? And we've seen it. One of my associates in Tanzania is the head of the cardiac unit there. And their cardiac unit is as good as our cardiac unit, in terms of the facilities and structure.
I see.
So, it's doable, but just not on the scale that we see here in America as of yet.
So it's just more, I think it's more in the realm of just like it takes more time.
Yep.
It's more of a slower process.
Well, we didn't get to where we are in America,
Overnight.
Again, look at some of the photographs around my office. You see these old iron beds and all that. Now we've got beds that tilt every direction. They're air mattresses and, all the technology. So we also in America have evolved.
Right.
What would you say is like, obviously in regards to, obviously technology is evolving. What are some of like the new groundbreaking techniques that are coming out now within neurological surgery that you yourself are also applying, whether that's in the OR or even just in clinic when you're referring them to your patients?
Right. So I think that, it's not new anymore, but stereotactic radiosurgery, which is, providing radiation to a tumor, to a vascular malformation in the brain, has been around for a while, but it continually gets upgraded and more refined. In my lifetime, the endovascular world of treating intracranial vascular and spinal vascular disorders, where we now put tiny little tubes into the arteries and feed them into the brain and feed them into the spine to treat vascular problems or to provide chemotherapy to tumors, has been transformative. More recently, the development of focused ultrasound, where we can hit 4 millimeter targets, and one of the most common things we use it for is for something called essential tremor, where your hands shake, and people can't drink, then they can't eat. So if we put a little lesion in their brain, their hands stop shaking, so they can lead a normal life. That's been transformative, and we're hopeful that we're going to be able to use that more widely for Parkinson's disease. It also may be useful for opening up something called the blood-brain barrier, so that we can get more chemotherapeutic agents into the brain to treat cancers. In the world of spine, when I started in spine, all there was what called Harrington rods. Now there are more plates, screws, intervertebral disc devices, artificial discs, image guidance, so they know exactly where they are, which is beneficial both in the spine and in the brain. The technological advances are what are responsible for what we were referring to earlier, was the improved outcomes in our neurosurgical patient population.
Well, now obviously, so when obviously you're in the OR and you operate on your patients and you're implementing these techniques, and then your patient comes back to you a few months later saying they've been healed, whether that they just had a tumor that was resected or they've obviously been healed of like a tremor. What would you say that's like one of like the most rewarding aspects as a physician when your patient comes back to you and they state to you, "Doc, I'm feeling a lot better. Like this, like thank you so much for your help and for your team and your care."
Absolutely. I mean, I have to admit, because it is neurosurgery, people say, "Oh, you're my God." I'm conflicted about that. I don't want that to go to my head. I always tell people that you're only as good as your last failure, right? And you can't forget the things that went wrong in your life. In terms of just, not that you did anything wrong, but a patient has a deadly disease, and you can't cure them, but in the time that they have left on this planet, you make their life more enjoyable for themselves, for their family, and that sort of thing. So, I mean, you just can't replace that feeling.
Right.
It's some people let it go to their head. I always try to remember it's not about me, it's about them.
Right.
I think that's the important thing. I know the reason I went into medicine. I think the reason you should go into medicine is because you do have an altruistic heart,
Right.
and you want to help people.
That's true. No, I think, like I said before, it's one thing to just, to work on your patients and do the job as it's intended, but there's also this, the emotional side to it, because you're not just working on, let's say, just some regular dummy or some frog,
Right.
in
No.
high school. No, this is real people with real feelings and emotions and complex ideas.
Well, working in New York, you both are from New York.
Yes.
So you understand that there's an incredible amount of anxiety that exists in this city.
Yeah,
Yes.
especially with a lot
And
of people in
I find that an inordinate number of my patients not only have a neurosurgical problem, but they have an anxiety issue.
Okay.
And so I spend a fair amount of time trying to get them to understand that most of them think, well, I'm anxious, I'm normal, I'm Woody Allen.
Right.
Right?
Yeah.
But I try to get them to realize that you could try to control that and maybe make your life a little bit better. And there are ways, aside from drugs, you can go and get an anxiolytic from a psychiatrist, but they only work in 70%. So there's 30% where it fails. But there's things like meditation, cognitive remediation, cognitive behavioral therapy, which
Mm-hmm.
doesn't involve drugs, and it can transform a patient's life.
True. I think I agree.
In regards to obviously kind of you're always trying to push more, positive information out to your patients. But can you talk to the viewer a little bit about obviously, you have your own podcast, This Is Your Brain. What has that experience been like for you personally? Obviously, while you're maintaining your duties as chair and
Yeah.
as obviously as physician.
Yeah, because you got a big plate. So adding that on too.
Yeah.
Well, I mean, listen, This Is Your Brain is a podcast, and it's about brain health from all perspectives. Again, I enjoy it because every author that I interview, I read the book that I'm interviewing them about, so I learn a lot. But it's also, again, I've been blessed by medicine. Not only in terms of the environment that I've been able to work in with incredibly interesting people in a beautiful city, that's anxiety laden, but I've really been blessed with an incredibly interesting patient population. And so I realized that I wanted to give back. On the other side, I also realized that there were individuals out there trying to tell people about brain health that had never done anything involving the brain.
Yes.
I'm sorry, I have a Ph.D., I've been a neurosurgeon for a long time. I think I understand a lot about the brain. So I felt as though I brought credibility to the topics that we're discussing. And so it's been, I've loved talking about your dog and your brain, sex in your brain, love in your brain, music in your brain, interpersonal relationships and how the right left brain work together. I hope I know that it's been informative to people because I get a lot of positive feedback.
No, 100%. I think you make a great point. There's a lot of people, and again with the social media, everybody's always trying to be the next big thing, and I think sometimes some might fall towards a path where they're just trying to push views and not try to, like we said earlier, give the correct information.
Yeah.
And with you, you have the credibility behind you, have all these accolades that give you the ability to have the platform to
Right.
perform.
Well, I'm going to be honest with you. I don't have 10 million followers. Okay. And that's part of the issue. I've thought about it. Do I want to become more TikTokish?
Right.
Okay. And interactive and kind of hip. But what I worry about with that is that you lose some of the context, you lose some of the meaning of what you're really talking about.
Really.
Right.
Yeah, the substance of the subject. So, you have to understand what your limitations are, who your target audience is, and what you're really trying to do.
Yeah.
And at the end of the day, the way I look at it, if I know I've saved one life in my time, okay. That's a pretty good accomplishment.
100%. Yeah.
Right? If I save 1,000, that's even more. But you can only do one thing at a time.
Yes,
That's
one
true.
thing at a time.
The whole concept of multitasking is an erroneous idea.
Yes.
Okay, your brain is only capable of doing one thing at a time. Now you can triage and break it up and then bounce between topics, but you can't write music and play music at the same time. You're going to write it, play it, Okay.
Like
Yeah.
you're almost doing like a switching back and forth
Yeah,
almost.
yeah.
Yeah.
It's what your computer does in terms of, the computers are based off the neural networks of your brain, right?
So sorry.
We'll edit that out.
Continue.
No. I mean, it's computers are based and modeled now after your brain in terms of creating neural networks, and that's fundamentally how AI is trying to work. It's integrating all of the information and then generating a new product. So I find it incredibly interesting about how we're going to try to replace human intelligence.
It's I'd say definitely an interesting subject to say the least, because if you talk about obviously what people try to do on a daily basis, like you mentioned, with like the multitasking, people will be like, I have a computer out, I have a tablet out, I'm listening to music with my AirPods in my ears, and I'm trying to do so much all at once, but in reality, it's like you said, you're really just dividing your attention into like little fractions of pieces.
Well, again, it's, can you listen to music and type on your computer? Yeah, but I mean, if I asked you a specific question about what instrument is playing in that music, you'd have to stop and think.
Right.
Okay, so it's, there are gray areas in terms of being able to do things at the same time, but you're really only achieving one true focused activity.
Okay.
And I think also that also goes back, obviously, with like kind of like the purpose of like the spread of information, right? Because obviously you started your podcast with the intention of education and trying to kind of making the public more aware of the certain issues within the brain and within neurological histology. And then now, obviously, with Rafi and I, kind of like our kind of focus with our podcast has been more of like the motivational side of like trying to discover what is it that one kind of has within like oneself to kind of continue to push forward no matter with the adversity that they face. Now, obviously, like you mentioned, you obviously go through lots of adversity there on a daily basis. That's with your team, with your patients, interacting various positions as a chair. What would you say is kind of like what keeps you going? Would you say is it more of your patients, or is it more of like the kind of like the altruistic side of yourself for your patients?
Well, I thought you were going to go in a different direction and start talking about the contemplative life, which I think is extremely important. I don't think that people take enough time to either meditate or be contemplative, because until you do that, you're not introspective, you don't know who you are, you really don't know what you value, and you kind of bounce like a ping pong ball.
That's true.
The TV tells me I'm this, the radio tells me I'm that, social media tells me I'm that. So you really have to spend alone time to discern who you are and what your value system is. And fundamentally, I mean, I have to admit it. I'm not married, and women will often tell me that there's not room in my life or in your life for me because you're married to your work, which is probably true. I'm very devoted to my work and I love it. So it's just the act of the job, and like I said earlier, I've been fortunate to have a job that is perfectly suited to my temperament and my skill set and my intellectual capabilities. So it gives me satisfaction on multiple levels. And, in each day, I mean, sitting here talking with two young guys like you is extremely rewarding to me. Maybe 20 years from now, you'll remember this conversation. You'll say, how did that affect me? Because I go back and look at my life, at my mentors, and I appreciate the things that they have said to me, or I appreciate the things that I've read in all these books. I read a lot of history and biographies because I try to learn from great individuals from the world. So it isn't any one thing that I love, but it's the combination of all of the things that medicine allows me. I mean, it fills my spiritual life, it fills my intellectual life, it fills my emotional life in being able to share with people. And then there's just the joy of watching, somebody run out of the hospital and get on with their life.
Right. No, I think it's definitely important to enjoy oneself, enjoy the moment of what you're living in. I think especially in the city that we live in, New York City, everybody's always on from point A to point B, and they often forget the journey that it takes to get to the destination. And as one says, it's all about the journey, not the destination.
But it's also, go to a restaurant and sit and watch families. How many of them are on their cell phones? Right?
Sure.
We've lost that introspective, contemplative, meditative time in our lives. That's why I grew up in the Midwest in the 50s. There wasn't all this distraction. The transistor radio was a new thing. So there was more time to think. But in addition to that, the family structure was very different. Nowadays, we don't have moms and dads sitting there talking and challenging their children like when I grew up. And I think that those are important things that we need to try to recapture.
I agree.
I think also it's always about kind of thinking, kind of like what Rafi said, and that's always not always about the destination, but obviously kind of going through those challenges.
The journey.
Right, the journey, the challenges you experience on a daily basis. I'd say like myself, obviously, I go to Columbia, and being at an undergraduate institution as great as Columbia is, you get to see obviously students of different backgrounds, whether of different bursts of study, right? But at the same time, each one kind of has their own challenge that they kind of gauge. And it's always interesting to see when people will say they have like a career change where they're like, I was interested in econ, now I want to go into medicine, or vice versa. I was interested in medicine, I want to go into econ, right? Those are stories that I tend to see. It's very prevalent. I think it also goes back to the idea of the loss of focus sometimes as well. People just find out what they're really into and they gauge more focus with that first.
Yeah. Well, one of the things too that I've noticed is, you meet somebody and the conversation starts gravitating towards what they think, what they feel, what they've done. And it's almost like they're marketing themselves or marketing some idea. I always gauge my interest in a person by how much do they say to me, well, Phil, what do you think? And how do you feel about this? Because everybody's so focused on telling you what they're thinking, doing, and what's of importance, I feel as though we've lost in our society the ability to have a dialogue about differing opinions.
True.
I mean, that's the beauty of being at Columbia,
Right.
is you have an incredibly diverse group of students there and faculty members that have very different opinions than you,
Yeah.
which is beautiful.
I
Okay.
agree.
I mean, and that's from my perspective, that's the beauty of America, is we've always been able to allow people to have that diversity of opinion and thought. And we, in my estimation, we appear to have lost that.
I agree as well.
Certainly in our government, we have extremes, and we just, if you see compromise, let me know.
Right. Oh, yeah, no, completely agree. I feel like we've definitely lost trying to find that middle area
Yeah.
for us to really be able to discuss about different opinions and viewpoints.
Yeah.
That
And I think that's got to be hard for gentlemen your age.
Mhm.
I mean, I grew up where, my God, my brothers, my family, we would have arguments and fights about
Whatever.
world politics,
Right.
religion, all
Yeah.
this stuff. And you kind of go, okay. At the end of the day, you kiss and make up and
Yeah,
and
exactly.
get on with it and realize, isn't it nice to be living here in America?
Right, exactly.
I remember going to China when they were asking me questions about our politicians, and I would be very frank about it. And they say, my God, you can say that? And I went, yeah, but that's what America has been,
Yeah.
and I hope we
And
can get back there.
It's definitely important. It's definitely important, especially again with like the current events that are going on right now
Yeah.
in the whole medical world. I mean, I mean, Jesse can attest to that.
Yeah.
I'm not going there.
But yeah, no, for sure.
I honestly think back to kind of being able to analyze just obviously different verses of opinion, because like you mentioned yourself, you can't really gauge obviously a new perspective without obviously hearing the other side or hearing a different opinion.
Yeah.
I think obviously, like you mentioned, listening is a key skill to have no matter in what industry, what field you go into, especially as a physician, whether you're listening to your patients or whether you're listening to your team and trying to gauge those different perspectives. What has that been like when you're obviously, you kind of take like a back seat sometimes? Obviously you do have your role as a chair, but you do obviously want to create that likability within the department, and you're
Yeah.
trying to kind of listening to advice and feedback from your peers. What has that been like for you?
It's been a challenge.
Mhm.
And the reason it's a challenge is, again, given our world environment right now, I'm finding that people are less willing to express how they really think and feel about something because they're worried about being criticized,
Yes.
That's true.
versus, I want to know. And let's have a dialogue. Personally, I've never assumed that I have all truth and knowledge. I'm not that smart. So it's been a challenge to try to get people to express their ideas and emotions about a topic. I'm sure you experience it every day. If you say something at school and somebody jumps down your throat for having said that, you're not going to do it anymore.
Yeah,
Right.
no, yeah,
Right?
Yeah.
Or my children, when they went to college, they would write their essays and they'd come to me and say, "Daddy, I'm getting B's and C's." And my advice to them was, well, write what the professor says, and then they got A's.
There you go.
Yeah.
But is that education or is that indoctrination?
There you go.
Right? So I'm hopeful that we can get more to education, which is critical thinking. At the end of the day, you get to make your mind up and make your decision. But I think we have to teach each other how to critically think.
Yeah, there's one thing to criticize. Another thing is to give constructive criticism.
Yeah.
And I think we definitely need to do more of that and just be open to the idea of just, okay, you have an opinion, I have one. It might not be the same, but as long as we have an understanding of one's point of view, we can still move on and live with our lives.
Right.
That's true.
Right.
So,
I mean, I think that, I'm a big Lincoln file.
yeah.
And one of the telling stories is obviously the Civil War started over the concept of slavery. But at the time, at the beginning of the war, Lincoln was very focused on preserving the Union. And so he was willing to allow slavery. But then he matured over that time period, and he recognized that the evils of slavery, right? And in the time that he had, unfortunately, he was taken from us too quickly. We had the Emancipation Proclamation, and that was his emotional evolution over time. And that's the other thing that I see is, you might have a political, religious worldview that's differing than mine, but over time, I would suspect we would probably migrate towards the middle and understand each other. And that's, again, the fractionation that I'm seeing right now is we're not allowing time. Everybody wants everything like that because you can turn on your cell phone and get satisfied.
Yes.
Okay, so it's in history, there are so many examples of just watching something evolve over time, and we actually get to where we're supposed to be.
Right. Yes.
But it'll never be idealistic. We're never going to have complete justice.
No.
We're never going to have complete equity.
Right. At that point, we're just in a utopia.
It'll be when I'm dead.
Yeah.
I honestly think that that all goes back to critical thinking, right? I think also, at least within the realm of medicine, right, with your residents as well, you would rather have your residents go through, think critically, and find ways to innovate for the patient before saying, what is the answer, right? What's the answer right away to this problem? Because if you're just feeding the answer right away, you lose that skill set of thinking critically and trying to develop that problem-solving process.
Yeah. And it's interesting too, because in a Ph.D., it's much more free thinking, whereas in medicine, it's much more algorithmic.
Right.
And I'm sure that that's true if you're a financial analyst. It's very algorithmic. You go boom, 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 and go through it, versus the Steve Jobs who was thinking at a different level, or now Elon Musk. I mean, he doesn't do everything at SpaceX or at Tesla, but he does have this understanding of the big world around him in terms of how to run those companies. Different types of thinking, but it points to the issue that you're trying to raise is one always has to be critical.
Yes.
You can't just assume. Even if you think you have it right, you have to question.
Yes. Always question. Always question.
The motto is that never always think that you found the right answer right away, but rather just always second guess yourself and say, is this the way I'm supposed to go, or is this the correct path, or is this the right path?
But I'm always going to tell you that I love cherry vanilla ice cream.
Yes.
I don't care what you say to me. I'm always going to love it.
Yes. At the end of the day, we always have our lines. So yeah, for sure.
Yeah.
But honestly, I think this has obviously been a great conversation.
It's been fun.
We appreciate having you on, Dr. Stieg, and for bringing us to your office, of course.
Yeah.
But honestly, I think that's all the time we have today.
All right. Thanks so much. I've got to get off to the OR.
Yes.
All right. Really nice meeting you. So you're at Columbia also?
No, I actually attend. I graduated City College 2 years ago.
Okay.
Yeah.
And what are you doing now?
I work with my father in his family, in our family business.
Which
is
is
a driving school.
a what?
A driving school.
Driving, like teaching. Oh yeah,
Bus,
Yeah.
cars.
you're
trucks,
doing that.
the whole show.
Yeah.
So you've got anxiety.
I have a lot of patience too. So.
It's funny. I just watched Mr. Holland's Opus. Have you ever seen that movie?
I've heard of
It's
it.
an old Richard Dreyfuss movie, and it's about a guy who's a musician who, wasn't being successful. So he became a music teacher at John F. Kennedy High School.
Gotcha.
And one of the things he did to make money during the summer was teach driver's ed, and it just showed the kids running over the garden and that kind of stuff.
The plan is not to get to that point. Yeah. But no, that's funny. That's definitely funny. But no, I mean, I think
Yes.
all his podcasts, his email, and everything is gonna be in the link.
Links will be down in the description.
Okay.
But yeah.
And as always, defy all the odds.
Yes.
Okay?
This is your host, Jesse, signing off. My co-host.
Your boy Rafa, as always, and again.
Thank you so much. It's
Dr.
been a
Stieg.
pleasure.
All
Thank you so much,
All
Dr.
right.
Stieg.
Thank you.
All right.
Deuces.
See you later.